It's a shame that people are looking for alternatives to conventional medicine to resolve their health issues and can't find it. The next 30 minutes could be the best time you ever spent for your health education. Hello, my name is Andre Patinode. For the last 25 years, my wife, Dr. Joyce, a psychologist, and I have been conducting workshops and seminars in the field of trauma and healthy relationships. We also enjoy attending health seminars in order to improve our own health. We realized that in order to reach optimum health, we had to be willing to do more than just eating organic foods and taking nutritional supplements. A few years ago, we attended a seminar on the subject of optimum health with a distinguished doctor in the field of integrative medicine. We learned that what we had been missing was the customized diet based on this doctor's methodology. So we decided to seek his counsel. We were evaluated in a very unique way, and based on his instructions, we stopped eating some foods that we thought were healthy, but were actually causing much intestinal discomfort. We changed our eating habits, and in a few weeks following our customized diets, we saw our health improve. As a result of our own experience, we started referring our patients to him, and they also had wonderful results and were very pleased. I asked the doctor to join me via satellite from his office and share his valuable knowledge with our patients, friends, and any other health-conscious people. So now, I welcome Dr. Reza.
Hello, and thank you very much for that warm introduction. I personally believe nothing helps deepen my own knowledge as effectively as sharing it with the others. It's a pleasure being here today.
I'm grateful that you accepted my invitation. Before I ask my questions, would you please tell us about your academic background?
Sure. I have a PhD degree in Eastern medicine. I am a licensed acupuncturist and clinical nutritionist. I've been trained in field of psychology, subconscious mind reprogramming, and informational medicine. And I have been in private practice for more than 25 years in Los Angeles, California.
And if I am correct, a doctor of integrative medicine means a practitioner who has been trained to treat different aspects of health, such as physical, mental, emotional, and energetic. What made you interested in becoming a doctor?
Well, it's a long story, but I believe my mother's health issue was the main reason. When I was about 10 years old, living back in Iran, my mom was suffering from severe digestive problem, lots of bloating and gas, combination of ulcerative colitis and Crohn's disease. After years of doctors' unsuccessful attempt of treating her with the restricted diet and harsh medications, the doctor recommended surgery, and in a matter of a year and a half, she had 3 surgeries. And he removed most of her large intestine since he believed that the large intestine was the cause of the bloating and gas. Unfortunately, after all the surgeries, her issue wasn't resolved. In her last follow-up with the doctor, I asked him, how come she still has bloating and gas? Didn't you remove her large intestine?
What was his response?
Well, he said, yes, but large intestine wasn't the cause. Her nervous system is causing it. I said, okay, why don't you fix her nervous system? He said, unfortunately, there is no treatment for that. I looked at him and I said, no, I don't believe you. If you know what is causing it, you could have, fix it.
I'm sure he wasn't expecting that from a 10-year-old.
I guess he wasn't. He looked at me and said, why don't you become a doctor, heal your mom, and let me know what the problem was?
That's when you decided to become a doctor?
Not really. Soon after we left his clinic, I forgot the whole conversation we had. It was years later, after I moved to United States to pursue higher education, that I became interested in the field of medicine. But since Western medicine was more about, procedures than offering prevention and wellness, I decided to study Eastern medicine. And after 8 years, I got my PhD in Eastern medicine. And few years later, after I became a clinical nutritionist, I developed my own method of healing to evaluate physical, psychological, emotional, and energetic aspect of the body. I went back to Iran after 15 years of being away to visit my family. During my stay, I noticed that my mom was suffering from severe digestive problems. I ran some tests in order to find out the underlying cause of her bloating. Evidently, the cause of her bloating wasn't the large intestine, stomach, or even nervous system. But based on my training in Eastern medicine, the underlying cause was dysfunction of the liver. I work on her with a customized diet, specific nutritional supplement, and herbal medicine, and gave her some acupuncture treatment. After about 30 days, most of her digestive issue resolved, especially the bloating was gone. I returned to US, and even after 6 months, when I talked to her on the phone, she was so happy with the result.
But I can't believe that she was suffering for 40 years due to a misdiagnosis. What's wrong with conventional medicine today? Why is heart disease the #1 killer in the United States with all the technological advancement that we have in cardiology?
Actually, the #1 killer is not heart disease anymore. It is medical malpractice.
Yes, I've heard that before.
You see, it's very similar to the car insurance commercial that I saw on TV, where a guy was complaining to the insurance agent for not getting enough money for his property damage. In response to his complaint, the agent said, "I guess you got the wrong insurance policy, my friend." And he said, "No, I got the wrong insurance company." So, to answer your question, I should say there is nothing wrong with the medicine today, except that people just choose the wrong type of medicine and expect to get positive result.
What do you mean by wrong type of medicine?
For example, Western medicine, as a very valuable medicine, is designed only for acute condition, urgent care, and surgeries. However, medication only works on acute conditions, not the chronic problem, such as my mother's digestive issue, cardiovascular disease, or even autoimmune disease like multiple sclerosis and lupus. Not forgetting that the leading cause of death and disability in the United States are chronic diseases, not the acute conditions. Therefore, when it comes to chronic, Western medicine is not the best medicine to have.
Okay, you're not saying that Western medicine is bad. It's just not appropriate for the conditions that you just mentioned.
Exactly. In my mother's case, unfortunately, Western medicine couldn't resolve her issue with medication and surgeries. But my method, based on Eastern medicine, was able to resolve her issues.
Why don't Western medical doctors incorporate other healing modalities, such as diet and nutrition, in their practice, instead of prescribing medications which have many side effects?
Well, if you go back to the beginning of medical practice, the father of modern medicine, Hippocrates, a true healer, said, "Let food be the medicine and medicine be the food." But unfortunately, today, medical doctors in 8 years of medical training have only a few months of training in nutritional therapy, which is not good enough for them to realize that the food is more important than the medications.
Then I guess we are better off with holistic methods, such as acupuncture, naturopathic medicine, or nutritional therapy than choosing Western medicine for our health concerns.
Oh, not really. It is not a matter of choosing one over the other. As a holistic health practitioner, my methods and training are not suitable to help someone who's having a heart attack, has a broken bone, or needs surgery. But Western medicine actually is the best for those cases. The point is to know which medicine is more appropriate for each health issue. As a practitioner of health, whether Western or Eastern, we don't have to be the hero all the time. You know, I have always been referring my patients to medical doctors, psychologists for further evaluation when it is necessary. And medical doctors should refer out their patient with chronic condition to other practitioners as well.
Thanks for making it clear.
You know, in hospital in China, they have both departments, Western medicine and Eastern medicine. Based on the patient's condition, a knowledgeable doctor will send them to the right department. because they found that some disease would recover best through Eastern medicine rather than Western. As you know, I have designed a nutritional program in form of a special workshop for medical doctors, psychologists, and dentists in order to teach them some of my methods of healing that they can supplement their own.
Yes, I have seen training sections on your website. What a great program for a practitioner to learn Eastern medicine methods for getting better results with their patients. I remember when I was attending your seminar, you asked the audience if they knew the meaning of the word doctor. Everyone, including medical doctors who were present and myself, said it means healer, but in fact, doctor means teacher.
Exactly. The word doctor comes from a Latin verb, docere, which means to teach. However, it doesn't mean to teach your patient medical procedures. This is how I teach my patients. First, I will make sure they understand that restoring health and getting healthy is very simple, but not easy. Let me talk about the simplicity of it first. We all can relate to the following example. You are in the kitchen, preparing the food, when suddenly you cut your finger with knife. As long as you keep it clean and don't expose it to the bacteria, meaning removing the obstacle, it will heal itself. No doctor needed unless it is a deep cut. Now, when it comes to any other illness and health issues, no matter how big the issue is, the same principle applies, even with some conditions such as cancer. Body heals itself, not the doctor, not the medication. The only thing that we have to do as a doctor is to remove the obstacles and let the healing take place naturally. At the same time, it is not easy because the difficulty most people have with staying in the good health has little to do with knowing how to do so. The tough part is changing lifestyle and habits, which takes dedication and strength.
I believe that changing the lifestyle is very important. With your approach, how do you help a person complaining of having a stressful life?
Well, first I will make sure that they understand the life is not stressful. It is the mind and the body which create the stress. Every day is happening to everyone. You might go through a situation stressfully, and I may go through the same situation with other stress. Therefore, suffering is not happening because of the life, but because of the mind and body imbalances. So knowing this, we always need to bring the body back to the homeostasis by balancing all aspects, emotional, mental, physical, and energetics, regardless of what symptom and issue we have.
I really enjoy our topic and discussion, but we are going to take a quick break, and we will be back shortly to cover the second part of our discussion on how to resolve our health issues with your powerful methods of healing. All right, welcome back. In the first part, we talked about the real meaning of health and sickness. Now, let's continue with how we can balance physical, mental, emotional, and energetic aspects with your methods of healing.
Well, that's $1 million question, my friend. In order to understand the how, we must know the differences between Western and Eastern medicine approaches. But I should say, by telling the differences, I'm not trying to separate Western and Eastern medicine and making one superior to the other. I'm actually trying to make them join forces to be more effective in treating a person. just like the way they practice it in China. Since we don't have much time, I only go over two most fundamental differences between Western and Eastern medicine approaches for just better understanding. Okay, this is the first one. In Western medicine, health is the absence of the disease, meaning someone without any symptoms are considered healthy. But unfortunately, we have seen it many times that a young person without having any obvious health issue or symptoms all of a sudden have a heart attack and drop dead. But in Eastern approach, health is more than the absence of the disease. Health is a state of complete physical, mental, emotional, and social well-being. That's why in Eastern medicine, we don't just treat the symptom, we treat the person.
But what do you mean by treating the person rather than the symptoms?
Okay, let's say you're driving your car. You suddenly notice that the radiator is leaking water. Do you just add a water to it and keep driving? Or at some point you just fix the hole?
Obviously, I will fix the hole or even change the radiator. Otherwise, the engine will be damaged.
Good. Treating a symptom is like adding water to the radiator and keep driving, and treating the person is like fixing the hole or changing the radiator, based on the example. Let's bring it to the medicine now. When someone has, let's say, a skin problem, such as acne, usually they get a topical cream to use, which is actually masking the underlying cause and usually very ineffective method. But with the Eastern medicine approach, for any skin issue, not only we give some topical for quick fix, we also look into the lung function, since the lung function is in charge of any skin and hair issues based on Eastern medicine approach. By doing that, we can prevent a more serious problem such as, let's say, skin cancer.
I guess dermatologists can benefit from what you just shared.
Now, this is the second fundamental differences. In Western medicine approach, all major organs such as liver, kidney, stomach, etc. have only physical functions, except the brain, which has both physical and psychological function. But from now on, I'm going to refer to psychological function to emotional function for just better understanding. Sensory functions, for example, are the physical function of the brain, and thinking is the emotional function of the brain. But when it comes to other organs, such as the liver, Western medicine only recognizes the physical function of it, such as metabolism of the fat and proteins, and no emotional function whatsoever. While Eastern tradition considers not only the physical function of the liver, but also the emotional function of the liver, such as controlling the emotion of anger.
Maybe Western medicine won't recognize the emotional function of the liver because it's not tangible and visible.
Well, that is not a valid objection, since thinking as the emotional function of the brain is not tangible or visible, yet no scientist or brain surgeon has ever seen a single thought in the brain. But they accept it as a fact, since when the brain is injured, the thinking capacity diminishes. Let me ask you this. How many times have you said, "My gut feeling told me not to do this"?
Many times.
That is the best proof that other organs beside the brain, such as our guts, have the emotional or psychological function. Let me tell you why. There are network of neurons lining our guts that are so extensive. Some scientists call the gut the second brain. Dr. Michael Gershon, the author of The Second Brain and the chairman of Department of Anatomy and Cell Biology at Columbia University, says, that's quote, "The second brain contains some 100 million neurons, more than in either the spinal cord or peripheral nervous system," unquote.
Very fascinating. I think people understand much better now what it means when you refer to an organ's emotional function. What are the emotional functions of other organs?
Joy is the emotional function of heart, anxiety for lungs, fear for kidneys, sadness for large intestine, compassion and empathy for spleen, and so on. But unfortunately, Western medicine won't recognize it as such. I personally believe not recognizing the emotional function of an organs other than brain is one of the main reasons of misdiagnosis in Western medicine, such as my mother's digestive problem, which was misdiagnosed because of not recognizing the emotional function of the liver as being in charge of digestive issue.
Then when you hear someone say, I'm angry all the time for no reason, basically, the person's liver is off balance and needs to be checked.
That is true. And if we don't pay attention to the message, it will turn to more serious physical problem. For example, sadness relates to emotional function of the large intestine. And if you stay sad for a longer period of time, it can turn to a physical problem such as severe abdominal pain.
Really? You know, Dr. Reza, I just realized something. When I was 11 years old, I developed severe pain in my belly. The doctor concluded that it was appendicitis, and of course they took out my appendix. I remember that we had moved to a different city. I think changing schools and leaving friends behind created a lot of sadness for me. But based on what you just said, I think my sadness caused my pain.
I believe you're right. Most probably you were misdiagnosed and ended up having unnecessary appendectomy. As I mentioned earlier, sadness is related to the emotional function of your large intestine. Since you stay sad for some times, it affected your large intestine function and created abdominal pain. You know, I actually read a book by a surgeon who admitted that 80% of appendectomies in 40s and 50s were not necessary.
I agree. My case was one of them. Let's move on to another important health subject, detoxifying. Do you think we need to detoxify?
Of course, everybody needs detoxifying. But the best way to detox is doing nothing, which means stop eating. The body will detox. Take a look at the dementia. It is a chronic case of toxemia, which means there is a toxicity in your blood system. So if you detoxify the right way with, for example, customized diet and proper nutritional supplement, the issue will be resolved. But if you start taking medication for dementia, you are actually creating more toxicity in the blood, since medication works only on acute condition, not the chronic one, as I mentioned it earlier.
That makes sense. Let's talk about a subject that I find mystifying. It's genetics. Aren't genes affecting our health no matter what we do?
Well, most people think so. They believe that we were born with a set of genes that are fixed and unchangeable. But we know that is not true anymore. In fact, in one study with identical twin brothers, one learned to play piano and the other one became a construction worker. After some time, the appearance and flexibility of their finger were completely different based on their activities, even though they had the same gene. In fact, genes only have effect on us if they are switched on.
Really? How do they get switched on?
Well, they get turned on by getting expression from environment, food, or even our emotions.
I see. Like the light switch. The electric power is there, but if we don't turn the switch on, we won't see the light. Then I guess the family history should not be as important as it seems. If my dad and mom are diabetic, the doctors say that my diabetes is due to my genetic signature, and there is nothing I could have done to prevent it. But based on the previous discussion, this is not true.
You're absolutely right. Even though you carry the diabetic gene from your parents, as long as you don't turn it on by getting the expression from bad environment, bad food, or even bad emotions, your diabetes stay hidden.
Does this apply to all other problems that run in the family? For example, obesity.
Well, most of the time, obesity runs in the family, not because of the genetics, but because of the following the same diet and lifestyle. You know, I guess some people, it's easier for them to blame it on the genetics than doing something about it.
I see. I never looked at it that way. Let's talk about some of the methods you do to help a person with their health concerns.
Well, we need to maintain the body normal function. We call it the state of homeostasis. One example of homeostasis in human is regulation of body temperature. Normal body temperature, as you know, is 98.6 degrees Fahrenheit. Temperatures below or above the normal level cause serious complication. Muscle failures occurs if temperature goes below normal, and central nervous system start to break down when it goes above normal temperature. And since every health issue could be the result of imbalances of one or all aspect of health, such as physical, mental, emotional, and energetic, we need to balance them all, no matter what. That's why I have designed few different evaluations to measure the physical, mental, emotional, and energetic signature of a person in order to recognize the underlying cause of the health issue. Then, by following their customized diet, taking proper whole food nutritional supplement such as mineral, enzyme, and vitamins, and in some cases getting some acupuncture treatment and herbal medicine, they will be able to resolve their health issue. But unfortunately, most people are under the impression that by eating organic food instead of processed food, or even by becoming a vegetarian, they will become healthy and prevent illnesses and degenerative diseases. In fact, the quality of the food comes second, and eating the right kind of food comes first. If chicken is bad for someone, then it doesn't matter what the quality is.
I have noticed that some people confuse your diet plan with blood type diets. But I know for a fact that after my 2 hours of nutritional evaluation, wasn't what you gave me.
No, that wasn't based on your blood type. But since my diet plan is derived from many other evaluation systems, such as Chinese medicine, Ayurvedic medicine, and even Western medicine, that's why it has some similarities, for instance, with a blood type diet plan. I even had a patient who had high cholesterol and high blood pressure. She was following her blood type diet for about 2 years without being able to resolve her issue. Her diet was almost 90% similar to my diet, but once she followed my new diet, which was only 10% different than what she was doing before, both issues were resolved in less than 3 months.
Can we say that nutritional deficiencies are the main reason for having degenerative diseases such as osteoporosis or MS?
Yes, mainly it is, but there are other factors involved when it comes to autoimmune disease such as MS. Based on my own experience with treating MS patients, nutritional deficiency was the underlying cause of their MS. I explain to you why. Because being on the wrong diet could create what we call it autoimmune disease, which means your own body is attacking you and goes against your health, and as a result develop conditions such as MS.
You mentioned multiple sclerosis. I know that you have been treating patients with MS using your method and actually cured it back in Iran.
Well, as a doctor, we don't cure anyone. Remember, we only remove the obstacles and let the healing take place naturally. But in my trip to Iran in 2001, I met a young lady in her mid-20s who was diagnosed with MS. She was under the treatment of a specialist for 2 years. Her symptoms were getting worse, such as vision problem and severe numbness on the right side of her body. When I ran my evaluation with her, I realized that her nutritional deficiency is the main cause of her condition. I gave her the right diet according to her metabolic type. We work on her mental and emotional state, and I told her to call me once a week at least, so that we can continue working on her mental state over the phone, since I was coming back to United States. After a few months, her doctor told her to stop the medication and injection since it wasn't necessary anymore. And after 6 months, she had no sign of MS. Later, she gave birth to beautiful twins who are healthy teenagers today, and it's been about 17 years since I met her. She still talks to me on the phone, and she's in a very, very good health.
I bet she is in your debt forever.
Well, I'm very happy for her. She worked very hard by following my instruction. You see, when they diagnose her with multiple sclerosis, it's just a name, like Apple. It doesn't mean anything, since it won't tell how she got the disease, what is causing it, and how to resolve it. Basically, instead of saying she has hardening of the tissue, they said in Greek or Latin word, sclerosis. You know, I believe doctors' primary job is not just to treat the disease, but to care for how people feel and how they function. 90% of the time, doctors fail in treating conditions such as MS is due to focusing on disease rather than the focusing on the person. The cure is not in the drugs. The cure is in the balance.
The good physician treats the disease. The great physician treats the patient who has the disease. Dr. Reza, there are many more important questions that I have to ask you, but unfortunately, we have reached the end of our program. I am hoping to have another opportunity like this in the near future, to have you on our program and benefit from your expertise, which is a powerful gift that deserves to be shared.
Sure, I will be more than happy to do that. And it was a pleasure and a great privilege to be here with you today.
Thank you, Dr. Reza. I really appreciate your time and effort to educate my audience. I just want to let everyone know that this live program has been recorded and you can have a chance to watch it again or share it with loved ones very soon. Just visit drreza.com to watch it again. Thank you all for joining us today. I wish you a very happy and healthy life.